So hi guys, my name is Philipp. Thank you very much for the introduction, and I'm here to talk about MedEngine. So neurodegenerative diseases are actually the leading cause of disability in the world right now, and Parkinson's is the fastest growing of them all. And the unique thing about Parkinson's is that it's actually increasing with economic development of a nation. So as nations get richer, more people get Parkinson's, which is very rare. And this fact actually contributes to the fact that Parkinson's experts right now consider it as a looming pandemic just because of the speed at which Parkinson's grows. So just to give you some numbers, there's about 10 million patients worldwide right now, and this number is actually expected to double over the next 20 years. So we'll have 20 million people living with Parkinson's worldwide. Currently it costs about 20,000 euros to treat each patient per year. And this is especially worrying because what essentially is happening right now is there is a supply inelastic condition in the market where the healthcare resources are constrained. So we see that not more people are specializing in neurological sort of like subjects, but still the patient number is increasing very rapidly, and that will cause an exponential increase in treatment costs in the future. So right now, there's about one specialist for every 500 patients in Europe. And you might think that is already quite bad, but if you look at countries like China, there's about one specialist that has to treat 10,000 patients at any given time. And what this translates to, if you are a Parkinson patient, is something like this. So you get about 10 minutes with your healthcare team a year, and for the rest of the time you have to be your own doctor. And this is a representation of a typical year. So the magenta spots are all the times you basically have to treat yourself, and the navy one is where you can get to see your doctor. And this obviously creates a lot of problems, and the biggest one is the Parkinson's iceberg. So this basically represents the current state of care. Most doctors and caretakers only have time to look at the motor symptoms of Parkinson's, so the really obvious ones like tremor, and all of the non-motor symptoms like depression, stiffness, anxiety, there's about 40 to 50 at the moment associated with Parkinson's, basically go unnoticed in the therapy. And this usually leaves patients disempowered, left alone, misunderstood, and they kind of feel lost in the therapy. And what we're trying to do is we're trying to capture a holistic view of Parkinson's with our solution. So we are creating an end-to-end solution that is able to capture motor symptoms through our custom-made wearable device, especially tailored to Parkinson's patients' needs, and an app that can be used to record non-motor symptoms, medication schedules, and other therapy-related parameters. This data is then shared with doctors, therapists, and nurses, and can be used by basically everyone in the Parkinson's care ecosystem. And this is great because it creates this sort of data-driven dialogue between all the different stakeholders and can really create meaningful dialogues and can help speed up research, can help increase or make better therapies, and can also help us find a cure. And what I mean by when I say that is there's a very, very good treatment option available for Parkinson's right now. It's called deep brain stimulation, but there's one central problem, and it's that not enough patients are referred for deep brain stimulation, and it comes from a lack of time that doctors have. And we can actually solve this problem because we can identify patients who would respond really well to this treatment through our solution, and we can automatically pre-screen them for doctors. And when I said we can help with research, this is actually the research landscape right now. So in 1961, there was a drug invented called levodopa, and it's still actually the gold standard treatment for Parkinson's. But you can see since its invention, the research has really picked up the pace, and people are actually pushing for a cure. But the problem is almost no clinical trials actually gather objective symptom data. And this is something we can also help to fix. In order to bring the solution to the market, we work with a lot of really great institutions that represent basically every stakeholder that we're trying to work with. So we work with the two biggest Parkinson's organizations in Europe, Parkinson's UK and Deutsche Parkinson-Vereinigung. We work with Europe's biggest university hospital, the Charité here in Berlin. And we also work with Europe's biggest health provider, the NHS in the UK. Thank you all very much for listening, and I hope you enjoyed the pitch.